Hello and welcome to today's video on monkeypox. We're going to talk about the monkeypox outbreak and do some searches into Google Trends. As you can see here, we're starting off with just the general word monkeypox. And as you can see, monkeypox is really not being searched a lot right now. Back in May, it went up and then it really dropped off. But what we want to do is we want to dive deeper. We want to look at things like blisters. That's something with monkeypox. Look at this. It's now at the highest possible level. How about rashes? And this is for the United States on the national level. We will go into a more regional approach in a moment. Look at rashes. Rashes is really starting to go up. How about we go to New York City, shall we? Take a look at this. New York City, it went up to the highest possible level, then it dropped off some. Remember, 0 is the lowest level, 100 is the highest level. Now, when we type in blisters for New York City, it does go up. Look at this. Highest possible level, 100, for blisters in New York City. Let's check out California, shall we? What's going on in California? I'm curious. California's at the highest possible level as well for blisters. How about rashes in California? Rashes is somewhat high, but not as high as blisters going on. Let's check out Florida, shall we? What's going on down in Florida? Oh, look at this. Florida, on the incomplete data for rashes, is projected to go to the highest level. Not good. How about blisters in Florida? Blisters is not as high as rashes. Seems like rashes is more commonly searched. And just for the heck of it, are people searching monkeypox in Florida? They were there for a while. Then it dropped down to near 0, but now it's slowly starting to go up again. Let's check Chicago, shall we? What's going on in Chicago? Chicago, they're not really searching for monkeypox, but how about rashes? Rashes was going up. Now it's projected to drop some, but at the moment, it is at 100. How about blisters in Chicago? Check out this. 75%, so not the highest value, but still relatively high. And let's check one more area. How about Washington, D.C.? Here we go. Washington, D.C. There's two of them, Maryland and Virginia. Well, we'll choose the Maryland one, shall we? Slightly going up, but it is projected to drop some for blisters. How about rashes? That's not rashes. There we go, rashes. Very low, but I'm wondering if we click on, there were two different Washingtons that come up. So we type in for the Washington for Virginia. Alright, that gives the same thing, but it also suggests we try Baltimore, shall we? What happens if we type rashes in for Baltimore? I'm curious. Whoa! Look what happens here. It starts off at 36, and now it's projected to go all the way up to 100. That's really bad. So now what's going on with blisters in Baltimore? Let's see. Blisters was projected to go up to 90, or it hit 90. Now it's projected to drop lower, but that's incomplete data, so we won't necessarily go 100% by that. Let's take a look at today's monkeypox numbers, shall we? So far, the total number of confirmed cases since this started around the world is at 11,083. Okay, here's the chart. The chart is literally going straight up. It's bad. The doubling factor, I believe, is now down to just 9 days. So every 9 days, the total number of cases worldwide is doubling, and that number seems to be shrinking. It's 9 days. It's probably soon going to be 8 days, which is not good at all. Around the world, Spain added 69 cases today. Germany added 58 cases today. The United States added 124 more cases today, but I stress, even though we are now over 1,053 cases, the total number is likely much higher. There is a backlog that the CDC has not yet added. And therefore, we're likely going to see a significant jump in the number of cases at the end of the week. We could see this go as high as 1,300 or 1,400 before the week is done. But still, adding 124 new cases today, that's pretty significant. And keep in mind, we're going to have testing capacity going up by a good amount soon. LabCorp has now upped the ante and said they will participate in doing 30,000 cases a week. So that's a high number of cases. Or tests, I should say, not cases. But, they'll have the capability to detect up to 30,000 cases a week, and I suspect we're going to probably see our number drop big time, or increase big time in the upcoming weeks. I could see us do 5 to 10,000 cases a week once this testing increase comes. And this is just based on the fact that it seems everybody knows at least someone at this point that has a mysterious rash, blister, or something strange going on with their skin that doesn't seem to be diagnosable. And real quickly before we move on, France added 191 cases today. I believe that's a one-day record for a 24-hour period. They now have 912 cases. So we typed in monkeypox here in Google, and look what happens. You get New York City monkeypox cases double again. Monkeypox vaccine appointments website crashes in New York City. Monkeypox vaccine in short supply across the country. I mean, it's just an utter disaster. Erie County, New York resident contracts monkeypox. And then we typed in monkeypox testing. Watch this. Vaccine remains in short supply as U.S. monkeypox cases grow. It's been terrible. Durham monkeypox patient struggled to get tested for virus. I mean, it shouldn't be this hard to get tested for monkeypox. Here we go. Monday, monkeypox testing started in Minnesota. That's good. Mayo Clinic's now going to do some monkeypox testing. That's good. I mean, it just goes on here. Oh, look at this. The Trinidad Express. Not sure which country this is. I'm assuming India. $900 testing for monkeypox. Really. They have to pay $900 to get a monkeypox test over there. It's just utterly ridiculous. Here we go, monkeypox testing. Why the outbreak might be bigger than we think. Gee, I can tell you why the outbreak might be bigger. It's hard for people to get a test right now. It's utterly ridiculous. People are being referred to, well, you need to go to a dermatologist. Well, urgent care doesn't know what to do. Primary doctors don't know what to do. It's ridiculous. We need some clear answers and guidance from the CDC, White House, and World Health Organization stating that if you show symptoms, you need to get tested. It shouldn't be where you have to jump through hoops and ladders just to get a test. This is the same thing that started with the coronavirus pandemic, and it needs to be addressed. Hopefully by August, it will be much easier, and we can get a clear picture of where this is going, because right now, it is an utter disaster. So, remember, here's my daily reminder for monkeypox. If you are showing symptoms, go to your doctor. Stress to them that you want to get a monkeypox test. Common symptoms are rashes, blisters. You're going to start out feeling like you have the common cold or flu-like symptoms with a fever. You might even stress cough. You might get dehydrated. And then eventually, you're going to see the rashes and blisters show up. You want to get tested before you get to the point of blisters and rashes on your face, on your arms, really anywhere on your body at this point. We're seeing pictures of people having it on their stomach, on their legs, their feet, mouth, nose. And unfortunately, some people, they do get itchy in the eyes, and we know monkeypox can cause people to go blind. A small number of people will go blind, and unfortunately, some people will pass on from monkeypox. It does have a fatality rate of somewhere between 1 and 10%. Okay, that's all for today. Thanks for watching this monkeypox outbreak update. Remember to hit the like and subscribe button down below and share these videos as much as you can. We need to get the message out that this is a serious situation. Stay safe, everyone.